Good morning, everyone. Today is our surgical day for implant installment. The patient is prepared. Let's proceed. We initially agreed on 3 implants. Do you recall our last discussion? We scanned your teeth and will use surgical templates. This is the surgical template. It's ready to be put on the teeth. We'll start implantation on the right side, moving left as we proceed. Now we will administer local anesthesia. All right, let's rinse and wait a moment. Let me test the fit of the template. It's situated perfectly in the oral cavity. The surgical templates are prepared. The patient was invited to our clinic for preliminary scanning before implantation. After scanning the teeth, I designed the surgical template and created it. It was printed in a 3D printer with dental-grade materials. It's ready for handling and completely non-toxic. I typically moisten the implant with cool saline before installation. We're done with this side. Everything's fine, and it took under an hour. We began the operation and installed 3 perfectly aligned implants using a surgical template. Now, we'll leave the patient to heal and allow osseointegration to occur. Next, we'll install gingival formers or create temporary restorations, followed by the final work. That's our future plan. For now, the implant is successfully installed.